Hello and welcome everyone to the Yale School of Management for MBA for Executives panel to highlight the Pozen-Commonwealth Fund Fellowship in Health Equity Leadership. My name is Wendy Sung and I have the pleasure of serving as the Assistant Dean for the MBA for Executives program. And I'm joined today by Dr. Howie Forman, Faculty Director for the Healthcare Area of Focus for our EMBA program, Dr. Marcella Nunez-Smith, Faculty Director for the Fellowship, and Dr. Karen Orjuela, alumna from the EMBA class of 2024 and a Pozen-Commonwealth Fund Fellow. We're so glad that you're here to learn about the incredible fellowship at Yale School of Management and the significant role our panelists, fellows, and this program plays in solving for inequities within the healthcare system. Through them, you'll learn about the mission of the Pozen-Commonwealth Fund Fellowship and its significance within the Yale MBA for Executives program. And we'll absolutely save some time at the end to answer your questions live. The Pozen-Commonwealth Fund Fellowship is sponsored by the Commonwealth Fund and the Yale School of Management MBA for Executives program, and is also endowed by a generous gift from Robert C. Pozen, a member of the Yale Law School class of 1972. For those of you who may not be familiar with the Commonwealth Fund, it was established in 1918 by Anna M. Harkins with the broad charge to enhance the common good. Today, the Commonwealth Fund's mission is to promote a high-performing, equitable healthcare system that achieves better access, improved quality, and greater efficiency, particularly for society's most vulnerable, including low-income people, the uninsured, and people of color. I just want to take a moment to thank our panel of esteemed healthcare experts for being with us today. They're incredibly busy and in demand, but committed to taking the time to share this important opportunity to make a difference in healthcare through leadership. And now it's my pleasure to allow our panel to introduce themselves, starting with Dr. Marcella Nunez-Smith.
Thank you so much, Wendy. And really also let me echo your welcome and thanks to everybody for joining us for this webinar today. We're really excited about your interest in learning more. As Wendy said, I'm Marcella Nunez-Smith. I have the deep honor and privilege of serving as the faculty director for the fellowship program. I am a physician researcher. I'm Associate Dean of Health Equity Research at the Yale School of Medicine. I have appointments as well at the School of Management and at the School of Public Health, and direct several research centers here at Yale. And also really quite always easy to get to yes to be part of policy conversations here locally at the state level and nationally, but really looking forward to sharing more with you about the fellowship today.
Thank you. Dr. Forman?
I'm Howie Forman. I'm a practicing radiologist at the School of Medicine, and I've been, privileged to be able to teach at the School of Management for about 25 years now. And I have been involved in the fellowship from inception. Marcella and I both were actively engaged with the team here in the original application, and we remain 100% committed to advancing health equity in this country and beyond. And we'll hopefully expand on that and take your questions shortly.
And Dr. Orjuela.
Thank you so much, Wendy, and all. It's a privilege for me to be here. I'm an alum. I did my MBA in 2024, and I'm a vascular neurologist and associate professor here at the Neurology Department at the University of Chicago, and I have a new role that I am the Chief Community Neurology Transformation Officer for the U Chicago Medicine System. So happy to be here.
Thank you so much. And we're delighted to have all of you here as well. So as we get started, I think it's important to acknowledge that recently there have been many changes that have impacted the healthcare industry, especially related to job security, research, and funding. As leaders at the Yale School of Management and through your involvement with the Pozen-Commonwealth Fund Fellowship, Can you speak to a little bit how you're addressing these challenges? What guidance would you offer healthcare professionals dedicated to advancing health equity today, in this climate? Maybe if we can start with Marcella.
Yeah, happy to, Wendy. And really appreciate that question. I think that's, top of mind for a lot of folks. I think especially a lot of people who are going to be interested in the fellowship and in today's conversation. There is no question there are certainly, acute challenges in this space. But I think it's also important for us to situate this in really a long arc, right? So, for those of us working, particularly in the health equity space, I think that historical and contemporary context are real, because here at Yale, at SOM, in the EMBA program and in the fellowship program, this really is about imparting people with the skills, as well as with, quite frankly, the knowledge network to be able to meet these kinds of moments in particular and meet these challenges head on. That doesn't take away. Look, we're all tracking very closely. We know that there are really big existential questions, or, right now, if we think about questions of financing, Medicaid, all right, if we think that's certainly within the healthcare system, but we know that the drivers of health and healthcare are even beyond, right, the healthcare system directly. So we look at things like SNAP and food assistance. So we know there are real questions and challenges afoot. But I want to make sure, like, even at the top of our conversation, to set the frame, this is when the expertise is needed the most, right? And so, I know that for, all the teams I'm part of, this team in particular, that we remain laser focused on that preparation for leaders who are going to be at those decision-making tables in times of challenge and crisis, as well as, in times when things are maybe less so. But that's the goal of the work that we do here. So we name the challenges, but we don't stop there, right? This is about getting that toolbox to respond and respond effectively in these moments.
Thank you. And Howie, you're actually teaching in the program right now. Can you talk a little bit about how all of this is playing out for you, and maybe in the classroom as well?
Sure. First, what I'd like to say is that the School of Management foundationally is built around service to not just business, but society. The origin of the school was a school in service to the for-profit and not-for-profit sector and the public sector. And in fact, the original degree offered was not an MBA, it was an MPPM, a Master's of Public and Private Management. Like, this is the sweet spot for the school. Since 1998, the school has had a deep connection to the School of Management, has had a persistent connection to the School of Public Health, and issues around health equity and quite frankly, justice have been central to the school's activities and origins. So I just think it's important to remind people that we didn't start doing this with the Pozen Fellowship. We've been doing this at the School of Management for way many years before I arrived here, and I expect we will continue to do that in the future. For me, I think what has been most valuable about us having the Pozen Fellowship and having a health equity lens is that using health equity as a for lack of an extra word, a lens to see all of the issues that surround us is very, very useful to understanding everything. It's not just how does Medicaid affect health equity, but how does health equity allow us to see Medicaid in terms of it being a glass half full as well as a glass half empty. And so when I'm teaching about Medicare or Medicaid or private health insurance, or talking about high deductible health plans and the equity issues that arise from those, or when we're talking about the pharmaceutical industry and where investments are made and where investments are not made, I think it becomes really valuable for students to be able to use that lens to think about it much more broadly than in an individual or just a profit-oriented interest. So I must say that having the fellowship just gives us one more grounding in an area that helps everybody in the classroom learn more about health and healthcare.
Thank you. You spoke a little bit about sort of the founding of the business school, the School of Management here, and our mission. Howie, can you talk a little bit, since you you were part of the beginning of the EMBA program as well as this fellowship? Can you talk a little bit about sort of the genesis story and the inspiration to launch the Executive MBA with a focus on healthcare, and then where we are now with Pozen-Commonwealth Fund Fellowship coming to the
Sure.
School of
Yeah, I'll try to
Management.
keep it real brief. I mean, in complete sincerity, I mean, the school recognized that we were a very small school at the time, maybe even 160 or 180 students per year at that point, and no additional degree program. So probably a quarter of the size we are now in terms of like total graduates, or a third, something like that. And the school thought, like, what is the area where we distinguish ourselves from other business schools in the country? And it turns out, it's really hard to find a school that is on a single campus with a medical school, with a public health school, that is blocks away from an economics department and a law school, and for which cutting edge research is being done in public health and healthcare, and yes, in health equity, at the time, really what was called racial disparities research often, but all different types of work going on here. And the idea was, like, how could we get a footprint in an area that distinguishes us? And so we launched first, the MD MBA program in '98, and then the EMBA program. The inception was officially 2003. The first class was seated in 2005. So we're exactly 20 years, perhaps even today might be the 20th anniversary of that first day of seating a class. And we moved on from that, and we built a program. And quite frankly, it took until about 10 or 11 years ago for it to be fully professionalized by bringing in staff like you, Wendy, and Keith, and everybody else that works with you. And we have a wonderful professional staff, and now multiple tracks available. The healthcare track is obviously the best track, but we only say that in our small circle like this. And so we carried on with that until about 8 years ago, I think about 8 years ago, we received a phone call from the Commonwealth Fund, facilitated by their consultants at the time, asking if we were willing to talk to them about developing a program that wasn't just about health policy or public health education for emerging leaders, but one that would be specifically focused on leadership. And how might we think about building a program like that? And really, 2 days later, I saw Marcella, and we had a conversation about this. And a month later or 2 months later, an RFP went out. And as they say, the rest is history. And we have worked together as a team, including you and Keith and Rosanna, and now Cece and Karen, and to continue to build this program. And we could not be more proud of what our alumni have already done, our current students are doing, and we look forward to meeting our applicants.
Marcella, can you talk a little bit more about the fellowship itself? How is it designed to support leaders in health equity? And, what kind of impact do you want to see from the leaders that go through this fellowship?
Yeah, of course. Absolutely. And I'm just refocusing because Howie took me all the way back to that initial conversation of the fellowship. But it's amazing that all these milestones are being really recognized and celebrated in this work. And I really just share his continued enthusiasm for this program. I do often refer to the program, the fellowship, as EMBA Plus, right? Because you're really getting the best, the best of all the worlds, everything that the EMBA has to offer. And you heard Howie talk about that some already. And then the fellowship is really layered on, right, experientially. And so I would also take this moment to nod, because there are a lot of people that make this happen, including the folks you see on the screen, obviously Wendy and Keith and Danielle and that entire team, and then the other directors of the fellowship program, Dr. Cece Calhoun, Dr. Gonzalez Colasso, who are here as well. and of course, really powered by our fellows. And I'm so excited to have Karen with us today to reflect on her experience on the fellowship. But there are many different components that we have curated very intentionally. You know, we respect and honor that what brings you to the fellowship is the fact that you are already making a lot of difference where you are. You have a sphere of influence and leadership today, and now you're in a very rigorous executive MBA program. So these are highly curated experiential components, everything designed to be very high yield. As we know, the time is so precious. So that ranges from the workshops that we have on Thursday nights. I also want to provide kind of a reminder of the sync that we do calendar-wise, so that the scheduling of these really is quite compatible with the scheduling for the EMBA. So, but we have Thursday night workshops that are a combination of particular skills building, as well as expanding your knowledge network, meeting other key leaders, action thought leaders in the space, in the sector. Through that venue. We're very fortunate to have a national advisory committee of experts too, who are generous with their time, interact with the fellows, in addition to the funders you mentioned up top, Mr. Pozen and the Commonwealth Fund, which brings in many other grantees from Commonwealth Fund too, to build that that community of learning and education. And then, we have a couple of signature things that I would just briefly highlight. One is at the sort of beginning, we have the immersion experience. So these are, days that are very intense, focused either on our local state landscape or on the national landscape, both community building as well as, enrichment opportunities. And then there is that capstone project, which is really sort of that gem as the second years are exiting, being able to share the work of their capstone extensively across all of our partner networks. So we're, this is a wonderful time. I would just, probably wrap by saying, to be looking at the fellowship. We've had through this many cohorts opportunities to do real time, both evaluation and refinement of all of the elements and components. So you're looking at the program when it's really reached quite, I think, an important and impressive stage of maturity, all of the balances figured out. But I'm really curious what Karen will have to say about the program.
Yeah, and so maybe I can direct the next question to Karen to talk a little bit about her experience. You were already doing such important work in the space, but what drew you to Yale for the MBA for Executives program and the fellowship? What inspired you to apply?
So, well, thank you. I echo what Marcella and Howie have been saying. And Wendy, it's a pleasure to see you here and my honor to answer that question. So I'm a neurologist at heart, and science was always sort of like a driving force for me and through my career. But I felt that to really make a difference, I had to have fresh tools, kind of like new lenses, new frameworks to try to apply really all the knowledge that I've been getting from my clinical experience, from my experience also outside the country, to the research and the business sort of like lenses that I was getting. So the MBA and the fellowship was able to broaden that perspective, give me new tools, give me a new mindset to kind of like see the important questions that I was actually, or emerging questions that I wanted to answer that were meaningful to the population, to my people, to my students as well. So one also part of bigger motivation was I had a mentee and I didn't know about this program, and my mentee, a neurology resident, she comes from an underrepresented background. So as a mentor, I always told her, you can do everything. You are amazing. And she's like, well, I found this program. This is perfect for you. And I was like, oh my God, I have to apply because I'm her role model. So I apply just to not let her down, to show her that what I was preaching, actually, I was walking the talk. And I was very fortunate to tell her that I was getting into a program. So I hope that she is listening and seeing this webinar. So that's a big shout out to Ashley, who pushes me to be better from my mentees. Mm-hmm.
Gosh, I love that. So Wendy, if I might,
Yeah.
I love that story. Get chills every time. And actually, we're looking forward to your application in the future. Yes. So, you asked too about success and what that looks like, and I'm, really curious to hear how you talk about this too. One of the gifts that we have in this program, because it is so, it's so right-sized, is the ability to really see each fellow, right, individually. And so this question of what success looks like is something that we go on that journey together, right? From the very beginning, we're sitting with each fellow to say, yeah, what does success look like for you, right? What are these goals? How can we be here in service of that vision that you have for your career and your future contributions? So it's really going to be vast, right? We want folks to be able to make change, to lead change, to be influencers, right? And so how that manifests, it will vary. Is that board service? Is that about expanding scope, where they are, looking at other opportunities? We had so many fellows get involved in leadership roles in professional associations, professional societies, people who are, testifying, being part of other advisory groups, setting new standards, expert consensus. So there are lots of ways I think that the leadership shows up. But how that success is defined, is something that we are here to work with people to determine, to define, and to achieve through the fellowship program.
That's wonderful. Yes. And also, Marcella, you had talked about the capstone that the students do at the very end. I've seen just, in my time here, the various ways our fellows have leveraged that capstone into sort of the work that they do or into new interest areas and such. So
Exactly.
yeah. So I'm sure at this time the audience might be interested to learn a little bit more of what it takes to be a successful candidate. Can you provide more insight into what the candidate qualifications are for the fellowship and for EMBA? And how do we make sure that there is maximum impact from participating in both the EMBA and the fellowship?
That's great. And how do you want to start? Because it really does begin with, being a great fit for EMBA.
Sure. I mean, what I would say is, first of all, nobody should ever decline to apply on their own without talking to our staff, because our staff are really well prepared to talk through what the requirements are. The absolute exclusions are people that do not have enough experience. So if you're straight out of college, you're not ready for this. And quite frankly, if you're straight out of medical school, you're not ready for this. Like, we want you to have some life experience and some foundation of work in the health equity space. It does not have to be in research. It does not have to be in direct clinical care, but it must be in the space that you have a commitment to that. We obviously need people to have quantitative and verbal capability, as test scores can sometimes help us weed out. But the frank truth is, the vast majority of people on this call and applicants are perfectly fine for that. So people that are afraid of taking a standardized test need not be. We use it just to make sure that we take our fiduciary responsibility seriously, because we're not looking for you to get a high score. We're not looking for you to be a mathematician or to have won, some math award somewhere. We just want to make sure that when you take some of our heavily quantitative courses, that your level set to the level that our other students are. And everybody in the EMBA program, whether you're in the finance track or the asset management track, healthcare sustainability, or in the undifferentiated track, must take a standardized test, but do not let that put you off. And then it really very much comes down to how much you can convey to the team that this is going to accelerate and catalyze your career in health equity. And to me, those are the fundamental features for applying both for the EMBA program and then for the Pozen Fellowship. But I think Marcella may be able to expand a little more on what we look for, and specifically the Pozen Fellows.
Yeah, absolutely. Thank you, Howie. I think that's right. That's a theme you'll hear from us today too, is really, we invite you to explore this interest, right? In the same way that we talk about the individualized approach to people who matriculate in the EMBA and the fellowship, hats off, Wendy and Keith and team. I have really been impressed watching just the, the really wonderful way in which this question is explored with our admissions team, right? Is this right for me? Is this right now? Am I the right fit? So that they really are your incredible resource in this question. But yeah, I would just quickly piggyback from Howie and say that when we're looking specifically for the fellows, yes, this element of I always say, it's not health equity 1.0. It's, health equity 3.0. So we're looking for that track record, right? Top line is that through your activities, your experiences, that you have quite a foundation in health equity already in framework and practice. And that it's really, about that individual being on the cusp professionally. Like right now is this key moment that's really going to allow them to open up their contributions even more. So I think that's really important. That aspect of having, at some point along the training, been patient, clinical facing and involved is really important. When we are in our small groups, be it on Thursday night or any of those other experiential activities, it's really key that we have quite a common understanding, knowledge, and similar North Star, right? At the end of the day, we are trying to make sure that the healthcare system is improved for these populations. And that is an ever-growing list, of populations. Right now, someone is texting me about some questions happening in rural communities with healthcare now. And so we're covering, all of these topics. And at the end of the day, it really does facilitate and elevate our conversation to have people coming in who are at similar starting points in those conversations. We are building a cohort, so that's the last thing I would probably say. So those individual achievements are really important, but we are thinking of how everyone is going to be complementary in that learning environment across both, cohorts and both fellowship years.
Thank you. Karen, would you talk a little bit about how the fellowship has impacted your work and how it's helped you address disparities in healthcare since the time, that you've started the program in 2022? And perhaps a broader question for the panelists, how fellows have translated their equity work into structural or policy level changes within their community.
Thank you, Wendy. I think that the fellowship was transformational for me. I think that at that stage of my career, definitely catalyzed a lot of what I consider I discover strengths within me and my job. So I'm really invested in working with communities to define brain health. And that could be a scientific community, that could be our family, our environment, our region. So I was very fortunate to use the skills that I learned to even find more courage in people, even with people that I might disagree, in find that common goal. So resources that the EMBA program taught me, economic thinking, negotiation, ability to find myself in leadership profiles or roles. For example, I'm a more traditional, like a servant leader. Those type of like multi-lenses framework skills have helped me to even design the job that I have along with my chair. So this is sort of like a long title goal, but for a community that it is so traditionally impacted for long-standing inequities like the South Side and Southlands of Chicago, thinking about brain health as a community is transformational, as my job title meant. I'm also an editor-in-chief of the first scientific journal that works in health equity for brain health, is Equity Neuroscience. And as Marcella said, I'm part of different boards of scientific societies with the American Heart Association here in Illinois and the Society of Equity Neuroscience. So we are leaders and pioneers in this field. And I think that even the circumstances, as Marcella said, are or seem adversary to this work, I think that this is where we are stronger, because we're built with the best skills to defy these challenges. So I'm very, very proud for this group. I'm very grateful for my colleagues and classmates that helped me to be here as well. And hopefully all the investment is absolutely keeping growing and multiply for the benefit of these communities as well.
Thank you. And Marcella and Howie, I don't know if you you have a few an example that you want to share about some of our fellows and what they've done, what they've learned here, and
I would, let me just start off just quickly, it partly in response to one of the comments made in the chat, that, you know, some of our most amazing fellows are absolutely not clinicians, researchers. So, I mean, somebody mentioned that we're over-indexing to that. I would point people to Fatima Dreyer, who is, you know, a world-renowned expert in reducing gun violence. She is I'm looking at her title right now, the executive director of the Center for Gun Violence Research and Education. I believe she's trained, if I'm not mistaken, as a lawyer. And Alicia Hardy, who is the CEO of a federally qualified community health center, a community health center in California. I mean, so, and then Crystal Yates, who is currently serving as a senior advisor to the mayor of Philadelphia. So I just want to point out, like, just because you're seeing Cece Calhoun or Karen Orjuela as our representation on any given thing doesn't mean that we're all clinicians or researchers there. And I couldn't be more proud of like the specific examples that each have done. Cece Calhoun in particular, who is a clinician, who has built a world-class sickle cell program at Yale, simultaneous with her own research and administrative and clinical work and so many other things and so many others. And Karen has already told you what she's done, which has just been amazing, including the scholarly work that she does. So I do think people need to take a step back and realize that we have a very broad definition of health equity. We do want it to be public facing and sort of facing the actual communities we serve, but that doesn't deny the entrepreneurship of someone like Fatima and others who've been going through the program. Marcella probably has more to say, but I just wanted to get
Gosh,
that
no,
out
I mean,
there.
you both said, you know, just I think covered it so thoroughly. So, you know, so this is always, we're going to be a broken record on this, right? Your individual circumstance is your individual circumstance, and bring that, you know, forward to the admissions team to start that process. We do recognize the multi-sectoral nature of this work, and do make sure that that is that it's reflected both in our fellows and in the, you know, the curricular enhancements here. But, you know, I just wanted to say just how lucky and fortunate I know I feel, I think the rest of the leadership does, to be able to bear witness to people's amazing career professional contributions, right? That's what we're looking for, you know, that's that success that people come back to. So, you know, that's really at the end of the day how we think, are we achieving, you know, our goals? Are we helping people get to theirs, right? That is what we are here to do. And I know I speak on behalf of the entire team. This is really honor work for us. So because I saw a comment about sort of everybody being busy, and Karen might be able to speak to the first part of that comment better. You know, how do you manage while you're going through this process all of those competing demands and priorities? I think that's a great question. But for us, I think on the leadership team, showing up is joy making for us. So we are here, you know, we are showing up, we're available. We are our forever community to our fellows too. So, you know, making sure that alumni are engaged and accessible to current fellows is high priority for us as well. But yeah, we've got all these stars. So, you know, it's, you know, pick a fellow and we can tell you about the amazing contributions that they are now. Everyone, really.
And to your point, Marcella, I mean, this is a forever community, and all of you and us are plugged into what the our alums are doing, our current fellows are doing. It's pretty amazing. Karen, maybe I can go back to you and have you talk a little bit about the balance of sort of all these different priorities in your life. When you were when you were in the program, you were commuting from Colorado every other
Yes.
weekend, and
Yes.
you had a very big job, and and like Marcella said, this is EMBA plus, right? So you have
Mhm.
all of the demands of EMBA plus the fellowship plus so love for you to talk a little bit about how you balanced all of that.
Well, thank you. And first of all, balance is not static, right? So it's a movement of pieces. So some days I have to prioritize my patients or my research or my health. And some days I have to prioritize EMBA and the fellowship and dedicate full attention and time. So I had the fortune to have the support of my chair and my institution, the University of Colorado, and my colleagues. So they were very supportive of that. So at first it was intense, but when you have that promise of doing something that you cannot miss, that's a lifetime opportunity, you just get up and do it. So I think that throughout the training, I would probably say like thank you to my team and my co-fellows that we succeeded, we made it. It wasn't easy, but some days where it was hard to pack. Packing was perhaps a little bit painful because I was leaving beautiful mountain sunny days to rain in the East Coast and back and forth. So I was kind of like feeling that I was not quite in one place or the other. But once I arrived to kind of like a school, kind of like was fireworks in my brain. So I learned from the best, and that was all that matters. So I think that someone in the chat also asked for strategies or how do I balance that. So I think that you have to understand my tips, perhaps are personal, but understanding that balance is movement. So there are days that are going to be intense. You should ask for help. You have a great support with your faculty, your team, and even your network, your family, your classmates. Be the best classmate and team member that you can be. So that actually is one of my stronger advices. It's not you by yourself, it's your team, it's your class. So if you understand that as a community benefit, that also will give you best results. And remember that it's a lifetime opportunity that I will keep, I'm a neurologist and I'm very nerdy that way. So keep that synaptic fireworks going in your brain. So strive for that. So you have a beautiful brain. So it's all that for this synaptic sort of energy coming from the fellowship. So those are my strategies.
Thank you. We're definitely going to take questions, so please put them into the Q&A, or I see people using the webinar chat as well. And Keith will address some of the admission-specific questions at the very end. But maybe I'll move over to some of the questions that have been coming in. And ask, given the current cutbacks in many programs, that support health equity, what part of the curriculum is affected by this?
We are not aware of any parts of the curriculum
Right.
effect. We do
We
not
love-
anticipate that. And
We love this question. None.
yeah, absolutely.
Great.
It's a great question, but I think this is a moment where I just to say thank you again very deeply to the reason we can say that. So very top of mind, of course, is the commitment from the Yale School of Medicine. I think it's management and School of Medicine. This is a partnership there, but Yale University, is one of the three legs to this stool, right, to make this work. So thanks to SOM, thanks to the Commonwealth Fund, and thanks to that generous gift by Bob Pozen. And so we are not looking at any components of the program being affected.
Great. There's a question about the capstone project. Are there existing partnerships or case examples of the capstones that have been scalable or multi-institutional initiatives?
Yeah, so the capstone project is it's a great opportunity for fellows. I know Karen's going to come in and talk about hers, but this is a great opportunity for fellows. So I would say there is a very well-developed infrastructure. I nod
Yeah.
to the co-directors here, Dr. Gonzalez Colasso, Dr. Calhoun, as well as another colleague, Dr. Sudaratana, who is helping lead that, and as well to the team and colleagues here at the Equity Research and Innovation Center, which is where I sit at the School of Medicine, that fully supports that capstone process for the fellows. So the first question, I think, is, how do the ideas sort of generate? And that too is an individualized, tailored process. We ask you to start thinking about this even at time of application, right? And early on, we're going to be thinking about that development. Our hope for every fellow is that the capstone project is going to be something that is instrumentally and structurally helpful for their career goals, right? This is not busy work. So when their goals make sense for something to be multi-institutional, then we're going to support that. But that's not by default going to be what makes the most sense for each question that's being asked and answered. But Karen, you want to tell us about your?
Yeah, no, and I think that what probably the word that I will use is the relevant for the fellow, the career and the goals of the program. Some of my co-fellows have done a capstone that involved their own sort of like institution or transforming or modifying or understanding different things where they are. Some of them have done other type of programs or projects, either partnering with other associations or institutions outside of their work necessarily. My personal capstone was more an entrepreneurial way of understand communication for Latinos in health. And throughout that, I've been applying this into my research, into my other entrepreneurial sort of like ideas here. And I think that I mean, I cannot tell you everything about my capstone right now, but what I think that is what is most relevant for the fellow. And as Marcella said, if that means that it's a scalable project, multi-institution, perhaps that will be maybe one of the capstones.
Great. There are a couple of questions related to the curriculum and entrepreneurship. Maybe I can ask Howie to address this. How aligned is the EMBA with a healthcare focus to a traditional MBA program? Are there entrepreneurship opportunities within the program?
Yeah, one thing about the program is that it may not be a program focused on entrepreneurship, but our output suggests that we're very good at it. The class of 2014 in particular has one, $500 million valuation project of two students, and another that is, I think, valued at closer to $1 billion. And that's just one class with that, and that doesn't even include like a half a dozen other people that have just exceeded expectations beyond belief, and that's just in 11 years. Every year we hear about new entrepreneurial efforts, and that's not an accident. It's because the core curriculum of the School of Management is a fantastic MBA foundation that is the identical foundation that our full-time students take, same professors teaching the same curriculum, just to a more mature audience. And the exchanges of ideas between the asset management, the sustainability, and now the undifferentiated track students allows our healthcare students to probably think even more broadly than they might if they were just in a healthcare-oriented program. So even though we talk about the healthcare track, it's only 6 specific courses, actually 4 required courses, but in the Pozen track, 6 specific courses that are healthcare. Everything else is core or elective MBA curriculum content.
And we will talk a little bit more about sort of the program and admissions at the very end. But as a closing question for our panelists, what is sort of one piece of advice you would give to prospective students interested in the EMBA program and the fellowship?
I'm going to start off just because I'm going to leave early today, and I want to make sure I get this in. Do not underestimate yourself. Talk to our admissions staff. I've seen many questions in the chat about whether people are ready or not, or whether there's not a single person that has asked a question for which I would think that they are not potentially a great candidate for the Pozen Fellowship. So don't underestimate yourself. Talk to our staff, go through the process. Today is the beginning of a conversation. It's not the end of a conversation. And we expect to be here for many years to come. So if you're not applying this year or next year, we'll look at you in 2 years because we're really excited about seeing your applications.
He took my advice. I'm gonna let Karen to get the final word on it, but that's right. I mean, you're showing up today, you're watching this webinar, you are curious about this
Yeah.
program. So really lean into that curiosity. We are very fortunate, I think, because of the resources, because of the investments that have been made, that we can engage one-on-one, right, with folks to talk about anything ranging from timing, right, readiness. And so take that next step and make that inquiry and learn more. But he took my advice. Karen?
Yes,
Great.
yes. My thank you. My last advice is don't be afraid of dreaming big because this is the place to do it. Whatever that means to you, pursue it with excellence. Don't be cheap when it comes to your dream because dreaming is free. Use your brain because your brain is beautiful.
It's great. That's awesome. I love that.
Well, thank you
We
so
all should
much.
love. Yep.
Me too. Dream
Thank you
big.
so much for your time. I'm going to pass the floor to Keith for him to talk a little bit more about the program and the process, and we can address some of the more detailed EMBA questions as well.
Yeah, thank you, Wendy. And I just want to thank all of our panelists as well. I know some of you may have to drop off a little bit early, but I do want to just spend the last couple of minutes sharing with you a little bit more information. I saw a lot of the questions that were kind of talking about the EMBA program. Hopefully everybody can see my screen right now. But what I want to do is just very briefly talk about what the program is. The Executive MBA program really is the main component. So when you think of the fellowship, you really want to think about the Executive MBA program. This is an on-campus program, so it does require that you take trips to campus. It starts off every year in July with a 2-week residency. So actually our students are here on campus today. They've kicked off the program with their 2-week residency. And then it goes to an every other Friday, Saturday format where you're coming to campus, you're going through your classes for the Executive MBA over 22 months. In between years 1 and 2, there is a Global Network Week, and I did see a question about that. I'm not gonna have time to dive too much into Global Network Week right now, but definitely please reach out to me and I'm happy to talk more about that. You'll then come back for 1 more week of residency and then back to that every other Friday, Saturday format. And so when you think about the fellowship, though, the fellowship adds on some additional things. And so what this does is really going to be additional to the 2-day Pozen immersion in June of each year. So there's one in your first year, one in your second year. And then there's the Thursday night workshops. Now, most of them are on Thursday nights. There are some full day Thursdays. It's not every class weekend, but there are 10 of them throughout the course of the year. So the fellowship sits on top of the Executive MBA program. And it's really important to understand that when you are applying even, you're first going to be going through the Executive MBA application, and then we will add the fellowship to that. And so, we've mentioned this a little bit, but it is open to healthcare professionals, leaders that are really committed to the improving access for the populations that really need it. And so, yes, there have been a lot of clinicians that have been in the program, but also we've had, we look for people, doctors, dentists, nurses, practitioners, pharmacists, PAs, psychologists, social workers. There's a lot of things, and I would always tell people, don't hold back. If you really are interested and you want to make a case, please connect with us because we can help walk you through the process. And, there's definitely opportunities from people from a variety of different fields. The fellowship itself does cover the cost of the MBA for Executives program, and it really is going to give you these skills that you're going to need. But one thing I have to do as the director of the MBA for Executives program is, unfortunately, not everyone will be selected as a fellow. Both the EMBA program and the fellowship are very competitive. And so there are sometimes people that are not selected as fellows, but are admitted to the Executive MBA program. And they end up enrolling because they really do understand that the classes, the coursework, the people that they will meet, both faculty and their classmates, really will help them move to that next step in their career. And so So again, I'm very, very willing to talk with people, myself, my entire team. We can help, really cover some of these things. As we conclude, I do want to just talk about the admissions process. So it's relatively straightforward. The application is closed right now, but it will be opening in mid-August. So this is a great time as you're sitting here in July, thinking about doing this. You can see here we have 3 rounds of application. One finishes at the end of October, end of February, and the end of March. What I would always tell people, if you are interested in the fellowship, I would strongly suggest applying in rounds 1 or 2. It just definitely gives you some more time. The fellowship committee will be looking at your applications as well. So highly recommended to apply in rounds 1 or 2. You can see the various different components of the application. There are some essays. There are from both the EMBA program. There's going to be the fellowship essays. We have optional video questions, letters of recommendation, your transcripts. The one thing that does give people some pause sometimes is we do require a valid exam score. So either a GRE, a GMAT, or what's called the executive assessment. If you haven't taken any of these exams in the last 5 years, I think it's important to, to know that you're going to want to prepare for these exams. And I really do push people to do the executive assessment. It's definitely geared more towards working professionals. There was one question that came up in the chat, is how many fellows are selected every year? It's usually 3. We've had a few in the past where there's been different numbers, but usually 3 fellows are selected per year. So you can definitely see that it is quite a competitive fellowship. Again, I am happy to talk with you through any of these points on the application, especially as it opens up in August. So what can you do for next steps? First off, if you haven't completed a pre-assessment, please do. If you go to our website, you'll see a link to complete a pre-assessment. One of our team members will get back to you. They will look at either your resume or your LinkedIn profile, and will give you a sense for, are you aligned with either the fellowship or the executive MBA? We'll start to have on-campus information sessions. The first one's going to be on August 9th. They will go throughout the fall and the spring. So those are the first couple are open for registration right now, but they will have them throughout the fall and the spring. Highly recommended. We always do host our information sessions on a class weekend, so you have the opportunity not just to meet the admission staff, but also our current students, our current fellows, and go to a class in the afternoon. We're going to be doing an executive assessment webinar that's coming up on August 13th. The invitation will go out for that very shortly. That's a great way, if you're a little bit worried about taking an exam, of getting yourself prepared for that. The other thing is, every month I do host a Pozen-Commonwealth Fund Fellowship chat. It's a much more informal chat where, it's just basically a Zoom meeting where everybody can see each other. We can have, it's a very open forum to ask any questions that you really might have. And so I host those monthly. My next one will be on, I don't have it written down here. It's in the middle of August. We also have one in September as well. If you do have any other questions, though, please feel free to reach out to us at emba.admissions@yale.edu, and happy to answer any of your questions. And so I went through that very, very quickly, I know, but I wanted to make sure we were able to finish up on time. We do have a number of other webinars coming up that walk through the entire program. If you come to an on-campus information session, we'll walk through this in great detail as well. So Marcella, I just see you popped yourself back on camera. Wendy is here, and Karen. So if there's any final comments from anybody, again, I went through that very, very quickly, but we will have a lot more opportunities. And really, truly, please do reach out, because we have I have a really great staff on my admissions team. We're happy to walk through any of these questions that you have that are more individual. So any final comments for any of our panelists?
Thank you, Keith. That was amazing. It's a lot of information, but you got it all out there. And thanks everybody for joining. We're really, again, excited for your interest in this fellowship program. Please take that next step. Looking forward to meeting you.
Excellent.
You guys on campus.
Yes, definitely. And thank you so much for staying for this entire thing. It was great. I really do appreciate all of our panelists. Great questions. And this will be available to rewatch on our YouTube site. We have a lot of other resources there as well, but hope to see you on campus in the very near future. All right. Have a great morning or afternoon.
Thank you. Thank you all.
Bye.
Great seeing you.
Thank you.
Bye.